So like what the Dicrotic Notch is like, so first let's talk about, so the heart is divided into these 4 chambers, right? And so the top 2 chambers are called what?
Atriums.
The atriums, right? So this one, remember, like, it's always the way the patient's looking at you, never the way you're looking at the patient, right? So this one would be the right. So you have the right atrium, the left atrium, then you have the right, what, down here? Ventricle and the left ventricle, right? And so how does blood get to the heart? The vena cavas, right? Exactly. They come through the inferior and then the superior, right? So that's being returned to your body as you walk. Your muscles actually squeeze your veins. It's kind of interesting. So like your veins, like so in your arteries, you can actually have muscle, right? And your arteries can constrict and like stuff like that. It's like if you have a hose and you squeeze it, it gets higher pressure. If you don't squeeze it, it gets less pressure, right? Well, the thing with your veins is your veins actually don't have muscle in them. They're just like tubing. And so like you can't cause blood to turn back to the heart without moving. Does that make sense? So like if this is your leg here, your foot, right? When you're walking, what happens to your calf muscles back here?
They flex.
They flex, right? And they get harder, they constrict, right? Well, if you have a big muscle right here, and you have a vein that kind of goes through, you can see veins in your arms, like that, right? And so when you do that, when your muscle constricts, it pushes it on that vein, and it pushes blood up, right? So by walking, squeezing your hands, it causes blood to come back to the vena cava. Kind of interesting. But so as that happens, it comes into the vena cava and enters in the right atrium, right? Then what's this first valve right there?
Tricuspid.
Tricuspid, right?
Or the right atrial ventricular.
Yeah, so we call that you can call it the right AV valve, or you can call it the tricuspid valve. And that AV means it goes from atrium to ventricle, right? Atrioventricular. Then we're going to pour into the ventricle. And when we pour into the ventricle, then now we're going to where after this? After the right ventricle. Is blood oxygenated yet? No. So where does it need to go?
Oh, it's the lungs.
The lungs, right? And so you have these 2 lungs that break off like this. Back here. And what is that valve that goes into there called?
Bicuspid or the pulmonary.
The pulmonary, right? Semilunar pulmonary valves, right? They kind of open up right here, and it goes into there. And now, is this the pulmonary arteries or pulmonary veins?
Arteries.
Arteries, right? Why are they called arteries?
Because they're going away from the heart.
Going away from the heart, right? So the pulmonary arteries go in there, carrying unoxygenated blood, gas exchange. It comes back red blood, right? So it's oxygenated. That's what we say. And it comes back to the pulmonary veins, right? Goes into where?
The left, what's it called?
Left atrium.
Atrium, right? And then it pulls into here. So now we're in here. So we came in through here, went to there, went to the lungs. Now we're coming back into here, right? Then we're going to go through what valve to get into the ventricle?
Bicuspid.
Bicuspid, right? Or also called the
Left AV valve.
left AV valve. We also call it the mitral valve.
Oh yeah.
More often you'll hear it called the mitral valve. If we're in a hospital, you're going to say mitral. It's like mitral regurgitation. Like they'll never just say like bicuspid, really. They always say mitral. I don't know why, but they just do. so why is the left ventricle one of the most important chambers of the heart? I mean, obviously they're all important. One fails, the whole heart fails. But like, what does this one really do?
They send blood to the body.
Yeah, exactly, right? Because from here, however hard this ventricle contracts depends on how hard the blood's gonna get pushed around the whole entire body, right? So it's pretty important that you have a pretty efficient, a good chamber, good muscles, and everything's working right in your left ventricle, right? Does that make sense? So where does it go from the left ventricle? Aortic semilunar valve, right? Why are they called semilunar valves? What does that mean?
But the way they're shaped.
The way they're shaped, right? Why is that important? Because this goes into like the Dicrotic Notch now. So why are they semilunar?
So blood doesn't flow back in.
Exactly, right? So blood doesn't flow back in. So like, what is a semilunar shape, right? So like, semilunar shape is kind of like this, right? It's kind of like a half of a moon, like a full moon would be a circle, semilunar, right? So if water's flowing this way, it can easily push those flaps this way, and they'll kind of go like this, and then water flows through, right? So what happens if water tries to flush back down this way?
They're gonna just close.
It slams them shut, right? And so because if you look how it's shaped, it's more passive this way, it's gonna hit resistance that way. And so it slams them shut, right? Well, when we do that, then we're closing the valve, and it prevents what we call regurgitation. So you want all the blood that gets pumped from here to go into the aorta, go feed the heart, and then feed the body, right? You don't want it to come back into the end of the ventricle. Does that make sense? So what is the dicrotic notch then? What is that? So first of all, where is it placed at? It's placed on this graph, right? So let's look at this graph real quick. It's on the wall is what it's measuring. So blood pressure is the measure on the arterial walls pushing out. Okay? And so what it's saying is right here you hit systole, right here, right? So systole is the contraction of the ventricle, like you said, and you're pushing blood into this aorta that's going to expand and put pressure on those walls. And you have these things called receptors that are baroreceptors that are going to sense the pressure there, right? And so when that receptor picks up that pressure, it says, oh, this is the pressure, and we relate that to millimeters of mercury. And so as we were saying, the dicrotic notch, as you kind of explained earlier, is if this is your heart, your left ventricle is here, your aorta kind of comes up like this, right? Then it kind of goes off into the carotids. Then you're going to have this kind of come down. Do you guys know the 3 arteries of the heart?
Right,
You have,
left coronary arteries.
yeah, you have the right coronary arteries, the left anterior descending, the LAD, and then the circumflex. And it kind of comes down there, right? So the blood gets pushed up into here, and the pressure in the aorta rises, right? They increase in pressure. Well, if you lost a lot of volume here and the chamber's open still, what happened to the pressure there? It decreased, right? Well, if the pressure decreases, what happens with this high pressure? It wants to go where?
Out.
It wants to go to the area of low pressure, right? Or out, right?
Since the semilunar valves are closed, it's got to go somewhere else.
Perfect, right? And so what happens is it's going to come down and slam against those, right? So it's going to slam those things shut, and when that happens, it makes what noise? Lub or dub? Dub, right? Or S1 and S2. Do you guys know what those? So that'd be S2, right? And so that's the end of systole. That's basically what it's saying. And so love comes down, it slams those valves shut, and when that happens, there's kind of this like, it kind of like expands them. Does that make sense? It like stretches them, and then it goes back that way. So if you look at it, the dicrotic notch is this thing right here, right? And so as it comes down, it loses pressure, then gains a little bit of pressure, then goes back down. So why is that? So like,
It's kind of like a trampoline a little bit.
exactly, right? It's a trampoline effect. So like, if you increase, so say you have 1 liter, that's a lot of blood to have in one pump, but like, not that much obviously, but say you have 1 liter of volume of something in a bucket, okay? So there's a certain amount, or like in like a pressurized tube, let's say, or you have 1 liter of anything in a pressurized tube. What happens if you expand the size of that and you make the tube this big, but you still have 1 liter? Does the pressure get bigger or smaller? The pressure went, what do you think?
Smaller.
Smaller, right? You have less pressure because you would have less force. There's more room for it to go around, less force on the walls, right? And so what happens is when you expand that, you're creating more room, right? Well, if you create more room, you're expanding basically expanding the chamber, you could say, making a little bit less pressure, and then it rebounds back up, like you said, the trampoline effect, it rebounds back up, the pressure kind of goes back up, and then as the blood leaves the aorta, it keeps going through the body, then the pressure starts to decline. Then we hit systole again. Let me go through that whole thing again.